Okay, next up we have Lachman's Test. This is the gold standard special test for ACL assessment. Basically what we're going to do here is we're going to try to perform an anterior drawer of the knee at 20 degrees of knee flexion, because that is where the open pack position of the knee is, and the ACL restricts anterior translation of the tibia. So with this special test, we're just trying to recreate the mechanism of injury, so to speak, or we're trying to play into the position that the ACL restricts. So if the ACL restricts anterior translation of the tibia, and we're trying to assess if it's torn, then we would obviously anterior translate the tibia to see if there's increased gapping. So let's just say this individual was on the field, they got injured, or it could be in the clinic as well the next day if they come in. But speaking of on the field, this is a test that you will see athletic trainers do right there on the field when someone gets injured. So next time you see someone rush on the field following a knee injury, try to watch and see what they do, and they're going to do some of this Lachman or anterior drawer style testing, okay, right on the field. Long story short, though, is that in the clinic, you would have your patient lay down. Let's say their left knee is the affected knee. You would start with the unaffected side. You're going to flex the knee up to about 20 degrees. You're going to support the leg the best way. I'll show you a few different ways you can do this, but you'll support the leg best way that you can based on the person that you're testing's anatomy. Sometimes larger individuals are here, and even myself, I can't get my hands in certain positions because the individual's legs are very muscular, so on and so forth. So what we're going to do here is we flex them up to 20 degrees, and then you're going to somehow stabilize the thigh. I'm going to let you kind of play around with that in practice. Then what I do is find the tibia by putting my thumb on the tibial tubercle, and then I'll wrap my testing hand behind the calf the best that I can. And so I'm going to stabilize with my top hand on the femur, and then with my bottom hand, I'm going to provide a quick jerk or a quick anterior based force on the tibia. So if you just relax best you can for me, we're going to pull upward like that. And essentially what we're trying to do is get the tibia to translate anterior. So in our example here, this was supposed to be their good leg, but you would do this on the uninvolved side. And what you're looking for is increased translation, and there's some different testing parameters. Some say 5 millimeters or more of translation might constitute a positive test. But again, the reason I'm going into this more in depth because this test is the one that you need to know the most for ACL testing. Okay, there's others as well, but this one you definitely need to know and get your hand placement right. So as we continue on here, let's just review that. 20 degrees of knee flexion, come in, stabilize the femur, find the tibial tubercle, provide an anterior drawer to the tibia. If the individual is too large, the way I like to do is I'll have the person slide over a little bit on the table, slide towards me just a little bit, and you're going to take their ankle of the affected leg and you're going to put it right, heel drops right off the edge of the table. So then I can pin the person's leg to the table, and then I can flex him up, and I can get a little better stabilization at the distal end of the leg as well. And sometimes that helps with larger individuals. So this test is the Lachman's test. Again, gold standard for ACL. And make sure that you know how to do this one correctly.